My name is Dustin Soriano. This is the intro to public administration. I decided to do my final paper on mental health care in the United States, My paper is written, goes over the problem and its origins within the United States, the effects of political and bureaucratic power on mental health and administrative law, ethical behavior concerns, federal concerns with mental health, and mental health within policy. So the origins of mental health frequently arise within the United States. Well, not the origins, but mental health in general frequently arises within the United States. Mental health can be traced fairly far back, all the way back to the time of Hippocrates, which is 400 BC, and they've even got some evidence that the Egyptians studied mental health as well. Mental health is characterized as anything that affects someone's thinking, mood, or behavior. There are disorders that can cause individuals who are mentally ill to have problems within their daily lives, relationships, and work. Examples of mental illness are anxiety disorders, depression, eating disorders, addictive behaviors, schizophrenia. Mental health in the United States and policies within regards to mental health within the states are still fairly new. Clifford Beers originally founded the Mental Health America, the MHA, in 1909. His intent was to assist the mentally ill by improving their lives through the efforts of research and lobbying. Since the spawn of the MHA, mental illness continues to be researched and studied in the U.S. today. There are continually new policies and procedures, such as the Affordable Care Act, that affect mental health and the treatment that the mentally ill receive within our country. But despite the efforts to thwart mental illness, it continues to be prevalent throughout many countries and societies in the modern world, including our own. So the effects of political and bureaucratic power on mental health. In about 2005, it was estimated, of course, we've always been the wealthiest country in the world. In about 2005, it was estimated that 40 million people were without the most basic health insurance coverage in the states. The public health care programs that benefit the indigent and poor are chronically underfunded, and the powerful insurance interests and private health care industry continually work to block or diminish all efforts for any sort of progressive health care reform. What this does for mental illness, we're going to talk about now, our capitalist society. The easiest way, or the best I found, was a research done by Michael Foucault, and he simplifies the effects that the human psyche and desire for power have, come to affect the political and bureaucratic interests within our system. Foucault explains how mental health treatment works under advanced capitalism, and he did this through developing a framework to understand, again, the capitalist society in regards to mental health. The three components are economic power, political institutional power, and ideological or discursive power. So economic power is motivated by profit margins in the economy. So, of course, the wealthy always have great access to phenomenal, mental health, leaving the poor and the working class citizens with little or no mental health at all. The political institutional power of it. Under capitalism, the mental health system is controlled and operated by a multitude of organizations and institutions that have been dominated by elite administrators, doctors, and experts. Back in the early times, about 40 years ago, the state-run hospitals went under a decentralization or suffered decentralization, and the state hospitals were shut down, and this left all the people displaced, and they got little or no treatment. Most of them ended up homeless in shelters. So the third part, the ideological or discursive power, is the capitalists consider mental health and illness to be a biological medical model that, they treat most mental illness as a pathology. The capitalists often blame those whom are mentally ill as acting outside of the social norm, ignoring, any type of social, economical, or political causes. So mental health and administrative law. As time passes, it almost seems as though mental health has been put on the back burner, but in recent years, new administrative laws have been approved and utilized by the politicians of the U.S. Some of the regulations have been implemented by states themselves and others by the federal government. In 2008, the Department of Health and Human Services, Labor, and the Treasury conjoined and issued a rule that increased the parity of mental health disorders and the benefits that they receive through a group or individual plan. The plan implemented came to be called Paul Wellstone and Pete Domenici Mental Health Parity and the Addiction Equity Act. It includes four main things are that the plan ensures that the deductibles, copays, and visit limitations are not restricted for mental health patients. The parity also extends to intensive outpatient facilities and residential institutions that provide intermediate levels of care. Number 3 is that the Act creates a transparency required for the health plans and its participants in order to maintain compliance with the law. And number 4, the provisions that allowed the insurance companies to make exceptions to the parity requirements for certain plans were also eliminated, therefore eliminating the insurance company loopholes and things that they were bound to find. Also, part of mental health and administrative law, the Affordable Care Act was signed by Obama in 2010, and it really extended, it allowed and made more attainable, affordable to individuals and families and small business owners, to get healthcare in general, which then elaborates into mental health. The Affordable Care Act allowed the Mental Health Parity and Addiction Equity Act to grow and become more prevalent by making mental health services on the top 10 essential one of the top 10 essential categories. The state of Florida has had, they implemented what they call the Mental Health Act regulation in 1999. It has continued to be adapted and modified throughout the years of its use. And now the Affordable Care Act has somewhat strengthened that. So ethical behavior concerns. There are critical issues and inequalities throughout the world in regards to mental health care. In many instances, mental health is overlooked, underappreciated, and under-resourced. An estimated 30% of the global population has some form of mental health disorder, and 2/3 of this 30% don't receive the appropriate care that they require. Here in the States, there are 57 million adults that suffer from some form of mental health disorder annually, and about 1 in every 17 of these people has a serious mental illness. It's estimated that by the year 2020, mental health will account for the largest percent of illness globally, 15%. That'll be higher than AIDS, traffic accidents, and heart disease combined. Despite the overwhelming evidence, the ethical concerns in regards to mental health and illness, it's definitely not to be underestimated. These problems and concerns stem from both social and economic contexts. You just can't deny or overlook the socioeconomic relationship between the two. And the equalities have been there for a long time. There's consistently been a lack of political effort and advocacy in regards to proper medical care and treatment for the mentally ill. They've put a stigma and they've discriminated towards mentally ill. And this has also led to unethical practices, improper funding of people and organizations who treat the mentally ill. The mentally ill in the States they've estimated it have cost about $79 billion, which has been lost, and about 63 billion of those dollars, the total amount, due to lack of productivity from the mentally ill, whom are at higher risk for institutionalization and are many times unable to engage in regular work activities and social activities for that matter. Federal concerns with mental health. Even though the United States has been having budget issues, Congress and the executive branch must continue to support mental health. They have made fairly robust strides in regards to mental health. The collapse of the community's mental health system throughout the country allowed the federal government the ability to transform the mental health system in order to better suit its, the consumers and the families, the general public. The federal role in the advancement of mental health has taken high consideration because of social justice and economic self-interest. Federal advocacy has made it possible for the mentally ill to have the ability to recover, what the federal advocacy calls transformation. By implementing the Affordable Care Act in 2010, the government outlined the benefit of mental health services. They expanded Medicaid, making it easier for people to get mental health services. They're also attempting to improve the needs of the military community, which are coming back with PTSD and TBI, traumatic brain injuries, and there's an overwhelming amount of them as well. Unfortunately, mental health programs and service funds are at risk of suffering a budget cut, but the federal government is working diligently with Congress in an attempt to negotiate and appropriate other fiscal means, financial funds, in order to continue mental health. But the federal government has taken great strides. Mental health within policy, there's three main things: the State Care Act, the Joint Commission, and the Affordable Care Act. And these are some really big ones in the past 100 or so years. The State Care Act has actually been around since 1890, and it's basically the act, the care of people with severe and debilitating mental illnesses was transferred to the state. But unfortunately, the cost shifting and that they were able to redefine certain patients, and then they transferred funds and got into loopholes and things. The Joint Commission is an American association. The American Medical Association and the American Psychiatric Association created the Joint Commission in 1955. Consists of a panel of commissioners. Even though these guys didn't always see eye to eye, didn't always agree with one another, they were able to get some great supportive policy through for state institutions, in regard to community health as far as mental health is concerned. And the Affordable Care Act, of course, the third and probably the biggest one. This act has to be the largest, is one of the largest, if not the largest, expansion for mental health coverage to date, and regular health and coverage and insurance as well. The Affordable Care Act granted the mentally ill the ability to utilize rehabilitation centers and receive outpatient services, the majority of which were not previously covered by insurance. As new laws, regulations, and policies have come into play within our government, mental health appears to be taking up some of the spotlight and gaining support from political figures and parties. It's been increasing in discussions and importance. Policies such as the Affordable Care Act seem to be continually modified, adjusted, and reinvented in order for the future general public to benefit from all these aspects of healthcare. And that's where we finish off with my paper. Thank you very much. Goodbye.